Is IVF necessary for all the pregnancies? Is it painful? Is it an abnormal procedure? These are certain questions that patients have for in vitro fertilization or test tube baby. Hi everyone, I'm Dr. Rosa Oliai, obstetrician and gynecologist, and I wanted to share with you certain answers to the queries and myths that is there with IVF. First of all, why should an IVF be done? Is it necessary that all women should undergo this procedure? Well, no. The answer is there are a lot of things, issues related. It depends on the age of the female. Usually, if a woman after the age of 33 comes to us, who has just got married maybe, or maybe her periods are irregular, we do a blood test and we get to know her AMH level, anti-Mullerian hormone level, depending on her reserve of egg, depending on how many years she's been married, depending on what medications she's undergone, or as a matter of fact, any female who comes after consulting a lot of gynecologists and she's come to know that there is some issues related with her, maybe her tubes. So when we see this picture, this is the uterus. So she must have been told that the tubes are blocked here. There is something with the tubes that is, difficult to get conceived, because after all the egg comes from here, the ovaries to the tube, sperm travels here, they meet and once get the pregnancy in the uterine cavity. Sometimes the females have got polycystic ovarian disease, wherein there are cysts in the ovaries, and because of the increase in hormone, she may not be getting the ovulation at the right time. Sometimes there are tumors, as you can see here. There are certain diseases which is related, like endometriosis, which makes the tubes adhere together. They get together. There are a lot of adhesions. The tubes are not in the same place. One is up, one is down. So there are certain issues and diseases which is necessary for the girl to be labeled, for the couple to be told that you're landing up in IVF. Similarly with the partners, the husbands. The semen level is low, less than 5 million. And this couple has tried a lot of intrauterine inseminations, when we call in short form IUIs. You've tried it for 4 cycles, 5 cycles, and now you're fed up. This is a time that you should come for an IVF, in vitro fertilization. And it's actually a process which is, really speaking, a normal process. It's not something synthetic that you're doing, because we take an egg from the ovary, we take the semen of the partner, the husbands, we make it in the petri dish, the embryo is formed, which is transferred here in the uterus. Now, with this pregnancy, yes, we have to give you a lot of medications, so it's a very precious pregnancy. You can walk around, you can do normal walks, not heavy exercises. Traveling depends on the doctor, it depends on the situation that you are in. So a lot of these queries are there in your mind that you should, really speaking, discuss it with your gynecologist. Make yourself prepared that what you're undergoing is something very natural. It's nothing abnormal. However, there are a lot of myths with it, that IVF leads into twin pregnancy. Only 10% of the IVF babies are twins. So it's a myth to know that all IVF, pregnancies are twins. Also, it's, really speaking, not necessary that all pregnancies should be IVF. On the other side, there are a lot of medicines available. There are a lot of, issues available. We have, infertility sometimes lead because of stress factor. So when you talk about stress, it's mental stress. It's physically you should be fit. It should be less pressure on you. So there are medications which nowadays we give in order that, the couple can, have a smooth, normal way of having sexual contact. Sometimes, patients come to us and they straight away want to go for an IVF. We have to counsel the patient. Are they knowing? Is the female aware when the ovulation is taking place? Usually if the cycle is normal, it's a 28-day cycle. On the 14th day, there is ovulation. Are you all having sexual contact during those days. Many patients are not aware of this very simple fact, and they think that now it is IVF that they have to do. So these are certain things that needs to be clarified before you come to the gynecologist and talk about it to your doctor. With IVF, yes, the medications are a little different, but however, for the 9 months, you are on the calcium, iron as par with your other counterpart. So, friends, don't be afraid. Go with the natural way. Consult your gynecologist. There are good medications now available for you to have a normal pregnancy, and not necessarily IVF. But even if it's an IVF, it's okay. It gives you a good chance. Thank you.